Welcome back. We continue looking at women's issues on this Women's Day here in South Africa, on the globe, and this time continue with our look at sexual and reproductive health rights. Amnesty International South Africa saying there is a significant increase in the number of adolescent and young girls falling pregnant in the country. The rights group says early pregnancy is a social, health and economic issue affecting children in South Africa. According to the Amnesty report, in South Africa between April 2017 and September of 2021, the number of births to young and adolescent girls between the ages of 10 and 14 years of age increased by 48.7%. Now, between April 2020 and March 2021, 934 girls between the ages of 10 and 14 years old gave birth in Gauteng alone. In January, the 1st of 2022, 65 babies were born to adolescent girls. The youngest was a 13-year-old from the Eastern Cape. Some really grim statistics. So let's speak about them now with Genevieve Quintal, Communications Officer at Amnesty International South Africa. Very good evening to you, Genevieve. It just literally makes you want to weep listening to those statistics. I mean, we can talk about the causes, and I actually remember reading some of the social media commentary when the statistics came out, even suggesting that it's because young girls are bored or they're looking for social grant money. It was really heartbreaking. And we know that a lot of this occurred during COVID-19. We saw that spike during that time.
Good evening, and thank you for having me. Yes, absolutely. The numbers are staggering. You know, and we've realized that while this is a societal issue that needs to be tackled by government and the people together, the state also has a lot of responsibility to create an enabling environment for people so that they can make informed decisions. And for young girls, you know, I get what you're saying. You say a lot of people have this perception that young girls are bored, etc. But there are so many other factors to this. You know, it's not about being bored. We should be concerned that girls as young as 10 are falling pregnant. And if you look at our law, this is actually statutory rape and falls within the confines of GBV. And there are other factors such as gender equality. I spoke about gender-based violence, substance abuse, poor access to contraceptives. There's a whole myriad of issues that go along with this. And the state really needs to come on board to make sure that we are ensuring that young girls make it to be they're the future women of this country, that they are able to be empowered and to make it in life and make it further without being confined by getting pregnant so early.
So looking at the stats again, it seems that young girls and adolescent women make up about a quarter of the percentage of the population. And it really still boggles the mind at the ages of 10 to 14 how obviously, they are sexually active because of the reasons that you mentioned. There's statutory rape, there's abuse, but there's also what they say sexually active sex activity amongst the peers. So sex education is said to be a problem. But sexual and reproductive health rights has long been a problem in this country in terms of the strategy of ending HIV, STIs, etc. But is it really just down to that? I mean, there surely is a more serious problem at hand.
Absolutely. And there are whole, like I said, myriad of issues and little parts that all should come together. You know, when it comes to sexual and reproductive health, there needs to be effective, age-appropriate and good quality comprehensive sexuality education and life skills programs that are delivered by well-trained teachers. So if we're going to education first. And research has actually shown that improved knowledge on HIV and pregnancy prevention decreases risk-taking and improves attitudes on contraception. So there's actually research-based outcomes of that. We also need to have guidelines for healthcare providers on the delivery of youth-friendly health services. I think we've heard too many stories of young girls going to clinic and either being shamed for being there for wanting contraceptives or shamed for wanting an abortion. You know, so there's that aspect as well. these should clearly advise how to, they should be how to assess adolescents' ability and maturity to understand medical information and make sure they have all the information they need. And so with that, also the guidance they need.
And of course, what this means is that we also create a poverty trap, because a lot of these young girls don't go back to schools. In a country where access to education, particularly in rural areas for young girls, is also dissatisfactory. And I see that we account for 23% of the global average of 19.1 million. I don't know how outdated these figures are. I think they're just perhaps off by a couple of months. But what are we doing in terms of community projects? Is there enough funding in the social support for these young girls?
So this is what we are actually calling for in our campaign, and why we took the decision to actually write to the president and to target the president in this campaign as the overall head of the cabinet. There are so many parts, so many different ministries that need to be involved: social development, education, health. We have women in the presidency. All these components need to come together. And yes, so we need to look at all those aspects of it and make sure that these girls aren't getting trapped in the cycle of poverty. I know people, and you spoke about in the beginning, that some people say girls are bored. Some of them are doing this so they can stay on the social grant, etc. But if you look at our system, we actually need a social grant that will help girls if they are pregnant at a young age, that allows them to carry on with schooling even though they're pregnant or even though they have a child. We need to look at issues like that, and we need everyone, all the different departments in government, to come together to put proper policies and proper training in place so that we don't leave girls behind.
One of the interviews we spoke to earlier on, Dr. Ndlovu was saying that there needs to be alignment at a government level, but we know there should be a multi-sectoral approach. So that means within communities, traditional leadership, and even organizations that deal solely with the health and welfare of the girl child. How should they be speaking to each other instead of competing? Because that's another thing that I see, that they compete for, visibility in terms of whose strategy is winning out, when we all have a common interest, and that is to protect the girl child.
Absolutely. And I think this is why, if we have proper, firstly, policies in place from a government point of view, proper guidelines for healthcare services, etc., then everyone is on the same page. We need to realize that we all got the same goal, that we want to move girls forward in this country. We don't want them to be stuck in a cycle. And so it really comes to putting the issue at the heart of it, and everyone coming together with the same objective in mind. And it starts with, as you said, governments aligning, the different departments aligning, policy aligning, and then from there have discussion that everyone is on the same page.
Genevieve, thank you so much for your time. Genevieve Quintal is the communications officer at Amnesty International South Africa, speaking about the increasing level of teenage pregnancy or adolescent girl pregnancy, ages between 10 and 14 years old. This is what they say. The figure really is high, 48 point something else percent. The increase, that's almost half the rate it was before 2 years before that. Very sad state of affairs there. But we're going to take a break. We are